Question 1. A pregnant client comes to the prenatal clinic for her first visit. The nurse notes that this is the client's third pregnancy. 4 years ago, she delivered a healthy boy at 38 weeks, and 2 years ago, she delivered a healthy girl at 35 weeks. Using the Gravida Para system to record the client's obstetrical history, the nurse will document A. Increased pulse rate. The fight-or-flight response evolved as a survival mechanism, enabling humans and other mammals to react quickly to life-threatening situations. The carefully orchestrated yet near-instantaneous sequence of hormonal changes and physiological responses helps a creature fight off the threat or flee to safety. The catecholamine release results in increased pulse, blood pressure, bronchodilation, perspiration, pupil dilation, and mental acuity. Urine output is decreased. Question 2. While providing preoperative education to a client, the nurse explains that the client will return from surgery with a sequential compression device, SCD. Which of the following statements by the nurse would be most correct? B. I should increase sodium and fluids, but limit potassium. Addison's disease develops when the adrenal glands are damaged. They don't make enough of the hormones cortisol and aldosterone. Besides corticosteroid medications, dietary changes include increased sodium, decreased potassium, and adequate fluid intake. Question 3. A 65-year-old calls the clinic to report they are experiencing severe left lumbar pain. After diagnostic testing, the client learns they have kidney stones in the left kidney. Initial treatment is provided and the client is instructed on dietary changes. An increase in which of the following will be most helpful in preventing a recurrence? B. I will drink more coffee and tea throughout the day. The U.S. National Academies of Sciences, Engineering, and Medicine determined that an adequate daily fluid intake is 3.7 l/day, about 16 cups, for males and 2.7 l/day, about 12 cups, for females. These recommendations cover all fluids, water, beverages, and food. About 20% of fluids come from food. Beverages with caffeine can increase fluid loss, so should not be the sole source of increased fluids. Alcoholic drinks also increase fluid loss. Question 4. A resident at the assisted living center pushes his tray onto the floor and shouts at the nurse, "This food is terrible. I can't stand this another minute." What is the nurse's best response? C. Perception of pain is subjective. Since pain is subjective, self-report is considered the gold standard and most accurate measure of pain. And NBSB. The other options are important to consider and possibly implement, but only after assessing the client's level and quality of pain. Question 5. The nurse is educating a client with cardiac disease who is taking furosemide and digoxin about eating foods rich in potassium. The client states, "I know I need potassium, but I get tired of eating bananas." The nurse then suggests choosing any of the following foods except B. Gravida 3, Para 2. Using the Gravida Para system, the nurse should record gravida 3, para 2. The client is pregnant for the third time, gravida 3, and has had 2 pregnancies of more than 20 weeks gestation each, para 2. The other options are incorrect. Question 6. A child with a new diagnosis of celiac disease is being discharged. The nurse provides education to the parents, including appropriate nutrition for their child. The nurse will instruct the parents to follow A. A. The SCD imitates the action of walking. A sequential compression device, SCD, is a method of DVT prevention that improves blood flow in the legs. SCDs are shaped like sleeves that wrap around the legs and inflate with air one at a time. This imitates walking and helps prevent blood clots. The SCD is worn while sitting or in bed. The device is removed for ambulating. Clients should still do foot exercises, included circles and flexing. Clients should be up and walking as soon as possible post-surgery, and continue to ambulate frequently. Question 7. A newborn is diagnosed with tracheoesophageal fistula, TEF, shortly after birth. Which finding will be most important for the nurse to report to the healthcare provider, HCP? C. Water. The best way to prevent or avoid a recurrence of kidney stones is to drink plenty of water. Kidney stones, also called renal calculi, nephrolithiasis or urolithiasis, are hard deposits made of minerals and salts that form inside the kidneys. It is the most common condition affecting the urinary system. And NBSB. Dietary changes are necessary with a diagnosis of kidney stones. A diet that's high in protein, sodium and sugar increases the risk of developing some types of kidney stones. The most common kidney stones are composed of calcium oxalate, found in peanuts, rhubarb, spinach, beets, Swiss chard, chocolate and sweet potatoes. Uric acid kidney stones are caused by red meat, organ meats, shellfish, and eggs. These foods should also be limited. Question 8. The nurse is educating a client with a new diagnosis of bursitis of the elbow, olecranon bursitis. Which statement by the client would indicate an understanding of proper treatment? B. Let's find something you might like better. Tell me what sounds good. If a resident erupts in an unusual way, try to understand the reasons behind the person's behavior. Do not respond in a rude or aggressive way. Offer an alternative and explore the reasons behind the behavior. In this case, it's not about the menu. The nurse should use therapeutic communication to assist the client. Question 9. In a neurological assessment, what does PERLA stand for? A. Blueberries. One baked potato, with the skin on, can deliver over 1,000 milligrams of potassium, more than twice the potassium in one small banana. And NBSB. Other foods that have more potassium than a small banana are raisins, lima beans, avocados, sweet potatoes, spinach, white or black beans, and squash. Blueberries are low in potassium and are often recommended for clients with chronic kidney disease. Question 10. A pediatric patient has been admitted to the unit with a diagnosis of right lower lobe, RLL, pneumonia. When auscultating the RLL, which sound should the nurse expect to hear? B. Gluten-free diet. Celiac disease results in an inability to tolerate wheat, barley, rye, and oats. A gluten-free diet is prescribed for a child with celiac disease. A lactose-free or lactose-restricted diet is prescribed for a child with lactose intolerance or diarrhea. A fat-restricted diet is prescribed for a child with disorders of the liver, gallbladder, or pancreas. Phosphorus restrictions are part of a renal diet, which also limits sodium and protein. Question 11. A 32-year-old female with no significant history comes to the clinic for a routine checkup. Where is the most appropriate spot to measure this client's pulse? C. Polyuria. Polyuria is a primary symptom of diabetes insipidus, with urine output more than 3 l/day. These clients have decreased or absent vasopressin secretion, which causes water loss in the urine and increased serum sodium. Anuria is the absence of urine output. Oliguria is urine output of less than 500 milliliters per day. Dysuria is difficult or painful urination. Question 12. A nursing home resident tells the nurse on the day shift, "No one answered my call light last night. I called and called, but one of them told me they had other residents to care for. I'm so sick, but no one cares." What is the nurse's best response? C. Cyanosis when feeding. The nurse should report any cyanotic episode to the HCP. A priority for TEF is to maintain an open airway and prevent aspiration. TEF is an abnormal connection between and NBSB, the esophagus and the trachea. As a result, swallowed liquids or food can be aspirated into the infant's lungs. Direct feeding into the stomach can also lead to reflux and aspiration of stomach acid and food. The other options are normal findings for a neonate. The normal respiratory rate range for a newborn is 40 to 60 breaths per minute. Tachycardia when crying is normal, at the top of the range of 107 to 181 bpm. Initial meconium is black, tarry, and sticky. Question 13. A client with a diagnosis of congestive heart failure, CHF, is on strict intake and output, I&O, with a daily weight. When the nurse records the 24-hour I&O, the client's intake was 2,200 milliliters, with an output of 1,200 milliliters. What will the next daily weight likely be? B. I'll apply moist heat 3 times a day. Bursitis is a painful condition that affects the small fluid-filled sacs, bursae, that cushion bones, tendons, and muscles near the joints. The most common locations for bursitis are the shoulder, elbow, and hip. The olecranon bursa is a thin fluid-filled sac located at the bony tip of the elbow, the olecranon. Moist heat dilates the blood vessels and decreases inflammation. The client should be instructed to apply the heat for 20 minutes TID. Treatment also involves taking NSAIDs and resting the joint by eliminating movements or exercise that can irritate the bursa. Resting elbows on a hard surface can cause bursitis. While ice can be used for the first 48 hours, dry ice is never used on a body surface. Question 14. After a client was diagnosed with gastroesophageal reflux disease, GERD, the nurse educates the client about diet. Which of the following foods should the client avoid? A. Pupils equally reactive to light and accommodation. The acronym PERLA stands for Pupils Equally Reactive to Light and Accommodation. Accommodation refers to your eye's ability to see things that are both close up and far away. The other options are incorrect. Question 15. The nurse is providing wound care for a client with a stage 3 pressure ulcer. Which of the following signs indicates that the wound is healing? A. Crackles. Crackles would most likely be heard because this would indicate fluid in the airspace. Fluid in the airspace is consistent with pneumonia. Wheezes indicate a narrowing of the airways. Stridor is an emergency lung sound that is heard in airway constriction that can lead to complete closure. Rhonchi is heard in mixed tissue airway constriction and secretions. Question 16. The nurse is instructing a client with a new sigmoid colostomy about caring for the colostomy. The nurse explains that to best regulate the bowel, the client should perform colostomy irrigation at the same time every day. What is the optimal time for doing this? C. Radial. For a client with an uncomplicated medical history, taking a radial pulse is appropriate. An apical pulse is appropriate for clients taking cardiovascular medications, such as digoxin. A carotid pulse is appropriate for emergency situations, such as cardiac arrest. Taking a femoral pulse is not necessary and can be considered an invasion of privacy. Question 17. Before administering an intermittent feeding by an enteral tube, the nurse measures the gastric residual volume, GRV. What is the correct reason for this nursing action? A. It's hard to have to ask for help and feel that no one helps. The nurse should reflect the resident's perceptions and feelings through empathy. Statements that are judgmental or patronizing are not therapeutic. Every shift is different, and the staff may have been occupied with situations that were more critical. But the nurse's task is to assist this resident with their perceptions and feelings. Question 18. When providing post-mortem care for a patient who will be an eye donor, which action is most appropriate? C. 2.2 pounds gain. The nurse can expect the client's weight to increase by 2.2 pounds. 1 liter of fluid is the same as 1 kilogram, both equal 2.2 pounds. To calculate, 1, 2,200 milliliters to 1,200 milliliters equals 1,000 milliliters. 2, 1,000 milliliters equals 1 liter. 3. 1 liter equals 2.2 pounds. Question 19. During a routine checkup, a client asks the nurse to suggest a breakfast that can help prevent constipation. Which of the following would be the best food choices? C. Pineapple. A client with GOUT should be instructed to avoid acidic foods, such as tomatoes or pineapple. Other foods to avoid are fatty or spicy dishes. The client should choose low-fat and high-fiber food items. White bread and bananas have fiber and are low in fat. Salmon is a low-fat alternative to fried foods. Question 20. When caring for a client who has an order for strict I&O, which is the best way to obtain accurate measurements? B. The wound bed is getting smaller. According to the National Pressure Ulcer Staging System, Stage 3. Full thickness skin loss involving damage or necrosis of subcutaneous tissue that may extend down to, but not through, underlying fascia. The end NBSB, ulcer and NBSB, presents clinically as a deep crater with or without undermining of adjacent tissue. Signs of healing include, the sore gets smaller, pinkish tissue starts forming along the edges, moving to the center, some bleeding may be present, indicating good circulation to the area. Eschar is dead tissue. When it covers a pressure ulcer, the wound can't be staged. Skin that is red and doesn't blanch when pressed indicates a stage I ulcer. Appearance of a serum-filled blister occurs in stage 2. Question 21. A primigravida client comes to the prenatal clinic after missing 3 periods. After her pregnancy has been confirmed, the client tells the nurse that her last period started on June 10th. Using Naegele's rule, what is the client's estimated date of delivery, EDD? C. An hour after a meal. Colostomy, irrigation and NBSB is a way to regulate bowel movements by emptying the colon at a scheduled time. It distends the bowel to stimulate peristalsis and promote evacuation. Patients who had a permanent colostomy made in the descending or sigmoid portion of the colon and had regular bowel function before having the NBSB, colostomy and NBSB, are good candidates for NBSB irrigation. It's most effective when performed about an hour after a meal, when the colon is most likely to be full. Question 22. A client has a nephrostomy tube. When the nurse assists the client to ambulate, which is the best way to keep the tube safe? B. Evaluate the absorption of the previous feeding. The correct response is to evaluate the absorption since the previous feeding. Enteral feeding, using a tube, is a low-risk, useful, and generally well-tolerated approach applied in clients with normal gastrointestinal, GI, tract and function. However, the leading cause of feeding intolerance is delayed gastric emptying, assessed by measuring the gastric residual volume, GRV. GRV is the amount of liquid drained from a stomach following administration of enteral feed. This liquid consists mainly of infused nutritional formula or water, and secreted GI juice. And NBSB. Measuring GRV also can prevent aspiration and vomiting if too much GRV is present. The other options are incorrect. Question 23. When transferring a client from the bed to a wheelchair, what is the first action? A. Cover the eyes with saline-soaked pads and place the patient in a low Fowler's position. When preparing a deceased patient for eye or corneal donation, close the eyes and cover them with soaked gauze pads to keep them moist. Apply a small ice pack to the eyes, if possible. Elevating the head of the bed will help the eyes remain closed. Question 24. Which type of ostomy puts a client at the most risk for skin breakdown? A. Oatmeal and a banana. The American Heart Association recommends a daily fiber intake of 25 to 30 grams from food, not supplements, on a 2,000-calorie diet for adults. Oats, with 5 grams of fiber, include nearly equal parts and NBSB, soluble and insoluble dietary fiber. Apples, bananas, oranges, and strawberries all have 3 to 4 grams of fiber, raspberries have 8 grams. A plain bagel and cream cheese have a combined total of 4 grams of fiber. Eggs and bacon contain 0 grams of fiber. A donut has 0.8 grams of fiber, and a glass of orange juice has 0.2 grams. Question 25. The nurse is educating a client who is scheduled for surgery for a descending colostomy. Which type of stool should the client expect after the surgery? C. Clear and reset all 4 pumps to 0 on each shift. The nurse or nursing delegate has sole responsibility for maintaining accurate I and AMP. O. Clearing and resetting for pumps will provide this information. Not all clients are on restricted intake when I and AMP. O is being monitored, so they may ask for fluids other than those provided at meal times. Asking a client to record their own intake and output is not appropriate. Question 26. A client with a nasogastric (NG) tube complains that his nasal passage is irritated. Which action by the nurse is most appropriate? B. The 17th of March. According to Naegele's rule, the estimated date of delivery, EDD, is calculated by subtracting 3 months from the first day of the normal menstrual period, June 10th to 3rd months equals March 10th, and then add 7 days. March 10th plus 7 days equals March 17th. The other dates are incorrect. Note, EDD replaces the former term, estimated date of confinement, EDC. Question 27. A client with a diagnosis of congestive heart failure, CHF, is placed on strict intake and output, I&O. The unlicensed assistive personnel, UAP, records the client's intake at lunch as 8 ounces of black coffee, 6 ounces of orange juice, 4 ounces of lime jello, and 4 ounces of vanilla pudding. What is the client's intake? A. Attach the tube to a leg collection bag. The nurse should attach the nephrostomy tube to a leg collection bag during ambulation. This allows easier movement and maintains the collection bag below waist level. Using a walker or holding the bag increases the risk of the tube being pulled out. The tube should not be clamped without a provider's prescription. Question 28. A client undergoing chemotherapy tells the nurse that they have constant nausea and would like to learn more about complementary therapy. Which of the following therapies can be safe and helpful for this client? B. Tell the client what is happening. With any procedure, first tell the client what is going to happen. The other options are part of the process of transferring to a wheelchair but not the first action. Question 29. Which of the following assessment findings is consistent with an extracellular fluid volume deficit? C. Ileostomy. An ostomy is an artificial excretory opening of the body, such as a colostomy or ileostomy. The ostomy type and leakage are major risk factors for skin complications. Ileostomy patients have been found to be at significantly greater risk of developing skin complications than colostomy patients. Ileostomy output, which is from the small intestine, is of a continuous, liquid nature. This output contains gastric and enzymatic agents that when present on skin can denude the skin in a few hours. Because of the caustic nature of this stoma output, adequate peristomal skin protection must be delivered to prevent skin breakdown. With a transverse colostomy, the stool is of a somewhat mushy and soft nature. With a sigmoid colostomy, the output is formed with an intermittent output. An ileal conduit is a urinary diversion, with the ureters being brought out to the abdominal wall. Question 30. The nurse doesn't admit for a client with a diagnosis of pleural effusion. When doing a respiratory assessment of this client, the nurse will determine if the client has C. Semiform to formed. The stool of a descending or sigmoid colostomy is semiform to formed, because much of the water has already been absorbed. The stool is firmer than that of a transverse colostomy and does not contain caustic enzymes. Elimination may occur at regular, predictable intervals after a certain amount of stool has collected in the bowel above the colostomy. Spilling can happen between bowel movements, because there is no anus to hold it back. Many people choose to wear a lightweight, disposable pouch for security. Question 31. Following delivery of a stillborn infant, a mother is transferred to a room in the postpartum unit. When the nurse enters the room to take vital signs and check the mother's uterus, the mother says, "Get out and leave me alone. It's people like you who let my baby die." Which is the nurse's most therapeutic response? D. Evaluate the absorption of the previous feeding. The correct response is to evaluate the absorption since the previous feeding. Enteral feeding, using a tube, is a low-risk, useful, and generally well-tolerated approach applied in clients with normal gastrointestinal (GI) tract and function. However, the leading cause of feeding intolerance is delayed gastric emptying, assessed by measuring the gastric residual volume, GRV. GRV is the amount of liquid drained from a stomach following administration of enteral feed. This liquid consists mainly of infused nutritional formula or water, and secreted GI juice. And NBSB. Measuring GRV also can prevent aspiration and vomiting if too much GRV is present. The other options are incorrect. Question 32. A client with a severe ankle sprain will be using crutches. Which of the following indicates that the crutches have been fitted correctly? D. Apply a water-soluble lubricant to the nares. The nurse should apply a water-soluble lubricant to the irritated nare. Repositioning the NG tube will not eliminate the irritation. Placing the client in a different position or using an ice pack will not affect the client's discomfort within the nasal passage. Question 33. The healthcare provider, HCP, prescribes strict intake and output, I&O, for a client with end-stage renal disease. When the nurse provides 6 ounces of ice chips to the client, how will the nurse record the liquid volume? D. 540 milliliters. Intake is considered any food that is liquid at room temperature. The client's intake is 8 plus 6 plus 4 is equal to 18 fluid ounces. 1 fluid ounce equals 30 milliliters, so 18 ounces equals 540 milliliters. Pudding is not included, because it is not a liquid at room temperature. Liquids include coffee, tea, milk, soft drinks, water, gelatin, jello, broth, ice cream, popsicles, sorbet, and nutritional supplement drinks, such as Ensure. Note: ice chips melt to half their volume. For example, if the client receives 8 ounces of ice chips, record the intake as 4 ounces. Question 34. The nurse delivers a meal tray to a client of Muslim faith. The tray has ham, a green salad with tomatoes, rice, corn, a roll, and butter. Hot tea is the beverage. What is the nurse's best action? D. Acupuncture. Acupuncture has been proven to relieve nausea and vomiting from chemotherapy. It has also been shown to relieve pain, help with a dry mouth, and reduce other side effects. Research shows that some complementary therapies are safe and effective when used with standard cancer treatment. And NBSB, complementary therapies can help people cope with the side effects of surgery, radiation therapy, chemotherapy, and other treatments. Other complementary therapies include yoga, tai chi, meditation, massage, exercise, and nutrition. Chiropractic care can relieve aches, pains, and stiffness in the joints, neck, and back. Some herbs have a negative effect on chemo drugs and how they metabolize. They also do not impact nausea. Examples are garlic, ginkgo, echinacea, and ginseng. Enemas can relieve constipation but do not address nausea.